Is it raining? I hope not. My car windows are down. My roof is down.
So Cindy, tell me a little bit about your experience with surgical healing arts and your experience with your surgeon and just your experience kind of overall in general.
Well, I am 4.5 years from vertical sleeve surgery. Dr. Shieh is my surgeon. I came to see him 6 years ago at a seminar, and we went forward with it in February of the following year. It's been amazing. It's been an amazing journey. Dr. Shieh is beyond attentive. His compassion, his knowledge, his understanding, his everything about him. He's my hero. Surgical healing arts, everybody here is like an extended family. Everybody just is so willing to share in your successes, but not judging in your failures either. But to be able to hold you by the hand and walk you through the whole system and the whole process. They will forever be my forever family.
Tell me a little bit about after you had your surgery and a little bit about just the follow-up care.
Well, after the surgery, prior to the surgery, we all get this Bible and this handbook. And sometimes it's a little hard to decipher, well, should I really be doing this or not? And so a lot of times when in doubt, I'd call the office and somebody would say, okay, yeah, you could do this, or no, you can't do this yet. So the follow-up care, even through the support groups and everything is so important because it's easy to get lost. It's easy to get lost in the information and what I call lost in the cyberspace. Cyberspace has all the answers, but not some of them are not, factual for our particular needs. And what might work for somebody else doesn't always work for you. And so I always say call the office, and they're always there. They're always responsive. They're 24/7. They'll call you back, and they always get back to us.
And then tell me a little bit about, have you been able to keep your weight off, and is your diet still basically the same post-op, and just a little bit about that?
Well, I have kept it off. I give myself what I call my little 5-pound leeway. I'm allowed to, gain 5 pounds, and 5 pounds is easy to get off. So once I see it creep into that 5, then I work to get it off. But my diet is the same. It's the same as today as it was post-surgery. I do my protein first, and that was drilled into our heads. Protein first, everything else is secondary. My carbs are minimal because I am a carb addict. I know that. So my carbs are minimal, and I stay with my protein. But that's also what helps me heal. I heal very quickly because of the amount of protein I get. So it will always remain. I still eat every 2.5 to 3 hours a day. It's what I have maintained, what works for me, and I swear by it. So I do exactly what I did from day one. I do it today.
And then Cindy, just lastly, you come to and you also speak at our support groups.
Yes.
And those are monthly. We offer those every month to all of our patients for a lifetime.
Right.
What's the importance of going to those support groups?
It's so important because I think so many times through this process, we all get into what I call our own little pity party. And when you are a food addict, you're just like any other addict. And when you don't have, when something triggers you and you're not able to eat what you think soothes you, you get into this little pity party. And so you always think that you're the only one. You're alone in this. And so by going to the support groups help you to understand, A, that you're not alone. B, you get great information that sometimes clarifies things for you or gives you that little boost. But you also have a camaraderie of a lot of other patients at a lot of different levels that they're at. And so, you work off their knowledge and you work off their experience. And so I think it's important and it's vital. I don't get to as many anymore as I used to, but I used to come every single month up until about a year ago. And I think it's important that you go, and I don't care how far out you are, it's important to understand, because sometimes the further out you get, the more dangerous it becomes. And that's where sometimes it's easier to slip back into the old habits. So sometimes it just gives you that little boost, that little kick that says, oops, straighten it out and fly right here. So I think they're vital. They're vital. If you don't take advantage of it, you're not going to succeed to the level you should.
Excellent. Thank you very much.
You're welcome. Thank you.